IndeeLift human floor lifts for emergency medical services allow responders to lift patients quickly and safely from the floor level to a height of 21 inches, where they can stand up from the seated position and walk away, or be transferred to a wheelchair or gurney without manual lifting. Eliminating the manual lifting of patients improves patient care while preventing lift-related injuries to patients and responders. The unit is constructed to meet the rigors of EMS use, particularly in areas with limited access. It's equipped with 6-inch wheels to assist in moving patients, can easily maneuver through tight spaces and around corners, and folds to a minimum footprint for stowage on fire apparatus, ambulances, or other special response units. With the detachable Stair Tread System, responders can safely transport patients downstairs. When stair transport is required, the emergency responders carry the IndeeLift human floor lift and the Stair Tread System components up the stairs to the location of the incident. Once the patient has been positioned onto the seat and properly secured to the lift using the waist and chest belts, one responder positions themselves behind the lift, then uses the up-down rocker switch to raise the seat to a height of approximately 12 to 14 inches. With the patient properly secured to the lift, the responder behind the lift wheels it to the top of the stairwell, where they install the upper handles and stair tread adapter. The upper handles are installed by inserting them into the mounting points on the top of the lift. The upper handles are left-right specific. Starting with the upper left handle, as viewed from behind, the responder pulls the spring-loaded handle locking pin outward while inserting the upper left handle into the mounting point as they release the locking pin, which snaps back into place. Then they pull up on the handle to make sure it's secured. They now install the second upper handle using the same method. Next, the responder behind the lift positions the stair tread adapter as shown, with the silver portions of the stair tread support struts facing upward. Then they release the 2 Velcro straps that hold the support struts in their stowed position. Important note: installation and removal of the stair tread components should only be performed when a patient is seated and secured to the lift. Installing or removing the stair treads without a patient on the lift will cause the lift to fall rearward. The responder behind the lift now inserts the right and left stair tread support struts into the corresponding mounting points on both sides of the lift, as shown, ensuring they firmly lock into position. Next, the responder positions the lower right side of the stair tread adapter over the stair tread fixed pin, as shown. Then the responder locates the spring-loaded left side locking pin, pulls it inward towards the center of the lift, and gives it a quarter turn in either direction to lock it in the open position. Next, the responder positions the lower left side stair tread adapter in place, then releases the locking pin by giving it a quarter turn in either direction. This allows the locking pin to secure the left side of the stair treads into position. Then the responder checks to be sure that both sides of the stair treads are firmly locked into the operational position, as shown. After performing these procedures a few times, it actually takes less than 1 minute to attach the upper handles and the stair tread adapter. The responder behind the lift now tilts the lift rearward, while the responder in front of the lift attaches the 2 lower handles. The lower handles are spring-loaded and attached to the mounting points by inserting them with the handles facing away from the lift. While pushing against the spring tension, the responder rotates the lower handles downward until they lock into the operational position and gives them a quick pull outward to make sure they are secured before proceeding. Once the lower handles have been locked into place, the 2 responders ensure the stair treads conform to the angle of the stairs, allowing the treads to bear the load as they safely transport the patient down the stairs. With IndeeLift's patented human floor lifts for EMS, equipped with the Stair Tread System, it only takes 2 responders of any size to safely transport patients from the location of a fall, even down flights of stairs. At the bottom of the stairs, the responder in front of the lift removes the 2 lower handles by pushing them inward and rotating them away from the lift. Note, if there is limited space at the bottom of the stairs, it is recommended that the stair treads and upper handles also be removed to allow for maximum maneuverability. The patient can now be transferred to an awaiting gurney.
Speaking to other firefighters, the #1 reason to use this is to save your backs. We all get injured. You want to have a long career, you want to have a full career, you need IndeeLift, and this is going to save you.